Okay, we're going to spend a few minutes this morning looking at the internal surface of the base of the skull and working out what all these foramini and structures are. Just to get orientated, the anterior of this skull is here and the posterior is here. So the first thing you look at this relatively low level is that the skull is actually divided into three major fossa areas. One called the anterior cranial fossa, and this is really where the frontal lobe of the brain sits. The middle cranial fossa, which is this area in here. And lastly, down at the back here, the posterior cranial fossa, and that's mainly where the cerebellum sits. And when you look at these fossa, they are divided by some ridges. And the first ridge here is actually this little ridge here, and that is the lesser wing of the sphenoid. And just so for completeness of the story, this area here and all of this around here, that is actually the greater wing of the sphenoid. And then the other ridge that separates the middle from the posterior cranial fossa is this ridge running along here, which is actually the edge of the petraeus temporal bone. So this is the edge of the petraeus temporal bone, and they form the boundaries, lesser wing of sphenoid and the petraeus temporal bone, between the anterior, middle and posterior cranial fossa. So what we'll do now is move on and have a look at some of the foramini in this skull, and as a first step we'll have a look at where the cranial nerves leave the skull. So let's just move up in magnification a little so we can see better. There we go. And we'll start up here in the anterior cranial fossa and talk about the first cranial nerve, cranial nerve 1, which is the olfactory nerve that leaves through this area here called the cribriform plate. And the cribriform plate is where cranial nerve 1 leaves, and that will actually go through into the top of the nasal cavity. Cranial nerve 2 is in this region here. There it is there, that foramen there, called the optic canal. And that makes sense because it's the optic nerve and it will be leaving through the optic canal. The third and the fourth, this pen's not so bright, is it? And the fourth cranial nerves all leave through this little slit just here. It looks better on this side. See this wide open area here? That's the third, fourth, and the first division of the fifth, in fact, and the sixth cranial nerves all leave through that one area just in there called the superior orbital fissure. And it looks much more obvious on this side here. Here is the superior orbital fissure. That there. And it's in fact the division between the lesser wing of the sphenoid. Remember we said this area up here was the lesser wing. There it is there, making up the top of the superior orbital fissure. And below it, this whole area here is greater wing of sphenoid. So the fissure is actually the divider between the lesser and the greater wing of the sphenoid bone. And while we're on this journey, if we just look here, this dent here is the pituitary fossa, and that's where the pituitary gland sits. So that is called the pituitary fossa. And as we continue our cranial nerve tour, we've now done cranial nerves 3, 4, the first division of 5 and 6, all running out through superior orbital fissure. We better do the second division of the fifth nerve, and that runs out through this foramen just here, which is called foramen rotundum. And foramen rotundum is called foramen rotundum because it's round. It's a circle when you're in cross section when you look at it, and that takes with it the second division of the trigeminal nerve, the maxillary division. The third division exits through this foramen here, called foramen ovale. And that is where V3 leaves. Clearly the trigeminal nerve is a large cranial nerve. In fact, it's the largest cranial nerve, most of which is sensory, leaving through foramen ovale, foramen rotundum, and superior orbital fissure. So we've done fifth nerve. Remember, the sixth makes its way back up and leaves through superior orbital fissure. So we're now down to the seventh cranial nerve. Where does it leave the skull? It leaves through this foramen just here, in the wall of the posterior cranial fossa. Remember, we said that this rim of the petrous temporal bone running across here is the boundary of the middle and the posterior cranial fossa. And this foramen just here is called the internal auditory meatus. And that's where the seventh cranial nerve leaves, and also the eighth, through the internal auditory meatus. And we come to the very last foramen for cranial nerves, which is this foramen here with its raggedy looking edges to it, and that is called the jugular foramen. And obviously the internal jugular leaves through there, and the 9th, 10th and 11th cranial nerves all leave through that foramen there, jugular foramen. The very last cranial nerve, and we actually can't see the foramen on this skull, but it sits just in deep in there, and that is, and its symmetry partner would be just over under there, which we can't see clearly, and that is called the hypoglossal canal. And that's where the 12th cranial nerve, the last cranial nerve, leaves the cranial space. So they are the foraminae for the cranial nerves. There are some other foraminae that we haven't talked about because they aren't foramen for cranial nerves, so we'll spend a few minutes just talking about them, but let's move to a fresh image so we can see better. So the other foraminae that we haven't really spoken about, obviously there's this large one here, which is foramen magnum. And that is where the spinal cord is going to leave to enter the vertebral canal. Also running out through there is two very important arteries, the left and the right vertebral arteries. And those vertebral arteries run down through the cervical vertebra to then have their blood supply basically come from the heart. And they come up and fuse just about here to form a very large artery called the basilar artery that runs up that area there. And that's one of the major suppliers of blood to the brain. And while we're talking of blood and the brain, we should also look at another foramen here, which is this foramen here, which is foramen lacerum. And in the front edge, or I beg your pardon, in the back edge of foramen lacerum, the other major artery that comes up to supply the brain comes up through that area, and that is the internal carotid artery, and it does this wonderfully interesting journey before it heads off out the sideways here. And similarly on this side here, we'll put another one here. And that's the internal carotid artery. We'll just write it over here. Internal carotid artery, and down here we'll just write vertebral artery. And in fact, interestingly, these arteries, the internal and the vertebral artery, come together in this lovely arterial circle called the Circle of Willis. And the Circle of Willis is a little arterial loop that loops around the pituitary fossa to provide blood out to the brain. So there's two more, foramen lacerum and foramen magnum, two other major foramini that we don't see for cranial nerves, but we see for other reasons. That's a good summary of all the foramini on the internal surface of the base of the skull. Thank you.